Up to 12 million. That is the number that it immediately jumped out at me when I started digging into the stack for this deep dive.
Yeah.
12 million adults over 40 in the U.S. are living with peripheral artery disease. PA.
It's a massive number.
Yeah.
And, honestly, that's probably a conservative estimate.
Right. And what's really scary isn't just the number itself, it's the silence. So much of the research suggests a huge chunk of those 12 million people are just walking around right now, completely unaware their circulation is compromised.
That's the whole silent epidemic aspect of it. I mean, we're all conditioned to ignore little aches and pains as we get older.
Oh, absolutely. Just part of aging.
Exactly. But with PAD, ignoring those signs until you're dealing with severe pain or worse, a non-healing ulcer, that's where the real danger is.
And that's exactly where we're going today. I think when most of us hear heart health, we picture something happening in the chest.
Sure, the classic Hollywood heart attack scene.
Exactly. Clutching the chest, shortness of breath. But the sources we're looking at show that often the very first sign of a circulation crisis isn't in your chest at all. It's happening way down in your big toe.
It makes perfect sense if you think about the body's plumbing. The feet are the furthest outpost. They're the hardest place for the heart to pump blood to, and it has to fight gravity to get it back up.
So if the supply lines are getting clogged...
That's where you see the shortages first. Absolutely.
Okay, so that is our mission for this deep dive. We are going to unpack that invisible link between your circulation and, believe it or not, your footwear. We've got a great stack of research here, some physiology breakdowns, and a really practical guide from DT Footwear on what you actually put on your feet.
And I want to be clear right from the start. This is not going to be generic advice. We're not just going to say, wear comfortable shoes.
That's advice that means absolutely nothing, honestly. Comfortable is completely subjective.
It's too vague to be useful. We're going to look at how PED actually changes the engineering requirements for a shoe. We'll look at why micro-traumas, these tiny injuries you might not even feel, can turn into major medical events.
I have to admit, when I first saw orthopedic shoes in the notes, I had this visceral reaction.
I know the image.
Yeah, those big, black, clunky Frankenstein boots. But reading through these sources, it really seems like the industry has caught up.
It has changed so much. The days of choosing between looking like a person and protecting your feet are mostly gone. You don't have to look like you're wearing a medical device. But, and this is the key, you do need to understand the biology before you buy the shoe.
All right, let's start there then. The biology. What is actually happening inside someone's leg when they have PA?
So imagine your artery is a 4-lane highway. Traffic's moving smoothly, supplies are getting delivered.
Okay.
Now with atherosclerosis, plaque starts to build up. It's like a construction crew starts dumping debris, fatty deposits, cholesterol in 2 of those lanes.
So you're down to a 2-lane highway.
Or maybe even 1. It creates a massive traffic jam. But instead of cars, it's red blood cells carrying oxygen and nutrients trying to get down to your feet.
And without that oxygen, the tissue it starves.
Starves is exactly the right word. The skin gets incredibly fragile. It doesn't have the fuel to maintain itself. And more importantly, it can't repair itself. And this is where we get the whole slow healing wound phenomenon.
Right. The sources mention that. A tiny scratch that would heal in a day for you or me
could linger for months for someone with PAD.
Yeah.
The body just can't get the repair crew to the site. The road's blocked.
Now, here's where it gets really tricky and honestly a little terrifying. The research talks about this sensory trap. Because PAD doesn't usually travel alone, does it?
No, it very frequently pairs with neuropathy nerve damage, which is often a complication of diabetes. It's a really dangerous combination.
How so?
Well, think of it this way. PAD restricts the blood flow, which makes the foot fragile. Neuropathy comes in and kills the alarm system.
And the alarm system is pain.
Correct. We don't like pain, but it's incredibly useful. Pain tells you, hey, stop, there's a rock in your shoe. But with neuropathy, that signal is just gone.
So you could be walking around with something in your shoe.
You could walk for miles on a blister as it forms because the pain signal never reaches your brain. You're effectively grinding that object into your foot with every single step, causing deep tissue damage, and you feel nothing.
That's a nightmare scenario. It's like driving a car with the check engine light broken. You don't know there's a problem until smoke is pouring out from under the hood.
That is a perfect analogy. And that smoke usually means irreversible damage.
So if we can't rely on pain, what should we be looking for? What are the physical signs?
Well, the sources highlight a few key things. First is cramping in the calves when you walk. It's called claudication. It's your muscles basically screaming for more oxygen than the blood flow can deliver.
And it goes away when you stop.
Usually, yes. It stops when you rest. Then look at the feet themselves. Coldness in the toes, numbness, that pins and needles feeling. A doctor can check for weak pulses, which is a major red flag. And finally, just look at the color.
The sources mentioned pale or bluish tones.
Right. If you elevate your leg and the foot turns pale, or you let it hang down and it gets a dark, dusky red or blue color, that's a sign the plumbing is seriously compromised.
And the stakes here are so high. I saw a stat in the DT Footwear source. It said 13.35% of patients with these risk factors get an ulcer. That's more than 1 in 10.
And we need to be very clear about what ulcer means here. This isn't just a sore. It's an open wound that refuses to close because there's not enough blood flow to build new tissue. That's the gateway to infection.
Which can lead to?
Amputation. In the worst cases, yes. So when we talk about footwear for PDA, we're not just talking about comfort. We're talking about limb preservation.
That completely reframes this. The shoe is not an accessory anymore. It's protective equipment, like a hard hat for your foot.
Precisely. And the data on this is it's undeniable. There was a 2024 cohort study that found ill-fitting footwear is one of the strongest risk factors for developing a diabetic foot ulcer.
How strong are we talking?
It increased the risk nearly tenfold over 2 years.
Tenfold. Just from wearing the wrong shoes. That is a massive number.
It is, and it makes perfect sense when you break down the physics of it. It all comes down to two forces, mechanical stress and friction.
Okay, let's unpack that. Mechanical stress is just pressure.
Pressure and compression, yeah. A shoe that's too tight squeezes all the small blood vessels. Remember, you've already got a traffic jam in the main artery.
Yeah.
A tight shoe is like putting up a roadblock on the last available side street. You're cutting off that final trickle of blood.
And then you add friction. The source called it shearing forces.
Right. Every step you take, your foot slides a little inside your shoe. It's unavoidable. But regular shoes, or shoes with prominent seams inside, they act like, well, like little saw blades on fragile skin.
I have never thought of a seam inside a shoe as a saw blade before.
To a foot with pain and neuropathy, it absolutely can be. Orthopedic shoes are designed from the inside out to minimize that friction, to stop that first layer of skin from ever breaking down.
Okay, so let's build the checklist. If I'm shopping for a paid-friendly shoe, what are the non-negotiables?
First and foremost, a roomy toe box.
And what does roomy actually mean? Not just comfortable.
It means your toes can spread out. Most fashion shoes taper to a point, which squeezes the toes and cuts off circulation. You need a box that's squared or rounded, so your toes can wiggle freely without touching the sides.
Wiggle room. Got it. What's next?
Extra depth.
Okay, why is that important?
2 reasons. First, swelling. People with vascular issues often have edema, so their feet change size during the day. You need that vertical space.
So a shoe that fits in the morning isn't choking your foot by the evening.
Exactly. And second, you need that depth to make room for custom inserts, which we'll get to.
Okay, so roomy toe box, extra depth. What about the back of the shoe?
A strong, firm heel counter. That's the part that cups your heel. It needs to be stable to prevent slipping, which helps with balance and reduces friction.
And finally, width. The source made a point to distinguish wide from medical wide.
There's a huge difference. A normal store might sell a 2E or maybe a 4E width. In the medical footwear world, a brand like Apis, we're talking about widths going up to 10E, even 14E.
14E, I didn't know that was a thing.
It is, and for someone with severe swelling or bulky bandages, it's the difference between being mobile and being stuck at home.
Okay, so let's get practical. Let's walk through some of these brands from the DT Footwear article, because they seem to fit different use cases. First up is the one you just mentioned, the heavy lifter Apis.
Apis is for the most challenging cases. If your feet are so swollen you haven't worn real shoes in years, or you have severe hammer toes or need to wear bandages, this is where you start. They're the ones making those 14E widths.
It's maximum accommodation.
That's the goal. They mentioned the Apis 9704 walking shoe and the 9721, which has double straps. Those straps are key because they allow for constant adjustment as your feet swell and shrink throughout the day.
That's really smart. And I saw they often come with 3 free heat moldable inserts, which seems like a big deal.
That's a huge value add. Yeah.
Okay, but what about someone who doesn't need that level of accommodation? Someone who just has poor circulation and wants to stay active?
For that person, the source highlights Propet. That's the active and lightweight category.
Right.
Propet is great because their shoes feel less medical. They use breathable mesh uppers, flexible outsoles. The model they pointed to was the Propet 1 Velocity.
The name implies movement.
And that's the whole point.
Yeah.
Walking is one of the best therapies for PAD, but you won't do it if your shoes feel like bricks. Propet makes it easier to stay active.
Next up, the modern and therapeutic brand, Anodyne. The source was really focused on their seamless interiors. Why is that so important?
It goes back to that sensory trap. If you can't feel pain, an internal seam is like a dull knife rubbing against your skin thousands of times a day.
It can saw right through without you knowing.
Exactly. Anodyne gets rid of those friction points. But they also highlighted another innovation I think is brilliant, the hands-free designs, like the Gnome 35 Sport Move.
Tell me about that. Why is hands-free so important?
Think about how you put on a normal sneaker. You jam your foot in, you crush the heel, you wiggle it around. All of that friction is trauma to fragile skin.
Something I do every day without a second thought.
Right. A hands-free shoe has a mechanism where the heel collapses as you step in and then pops back up. No friction. It prevents heel ulcers and also helps prevent falls from trying to balance on one leg. It's a game changer for mobility.
Yeah, that is. That's genius. Okay, one more major one. The veteran, Drew.
Drew has been a standard for a long time. They do a great job blending medical-grade features, deep toe boxes, strong heel counters, with more traditional athletic styles. They mentioned the Drew Flash 2 for women and the Drew Bexley II slip-on for men.
And we should give a quick nod to the honorable mentions. iTech, noted for including custom inserts, and Orthofeet for their Roam hands-free sneaker.
Right, and another great example of that hands-free tech becoming more standard, which is great to see.
So we've got the shoe itself, but now let's talk about what goes inside. The source kept mentioning heat-moldable inserts. What are these, and why isn't a simple gel insole from the pharmacy enough?
A pharmacy insole is just cushioning. It's a pillow. But for pad and diabetes, you don't just need cushioning. You need pressure redistribution.
That's the difference.
Well, think about standing barefoot. All your weight is concentrated on your heel and the ball of your foot. We call those hot spots of high pressure.
And that's where ulcers form.
Exactly. A heat-moldable insert is warmed up, and then it forms to the exact contours of your foot. It fills in your arch, it cradles everything. This creates a concept called offloading.
Offloading, explain that.
By increasing the surface area of contact between your foot and the shoe, you spread your body weight out evenly. Instead of all the pressure being on two small spots, it's distributed across the entire sole of your foot. You eliminate the hot spots.
So it's like lying on a proper mattress versus lying on a concrete floor.
That's a perfect analogy. The clinical evidence shows these orthoses meaningfully reduce pain and keep the pressure on your tissues within safe limits. It's truly engineering for your feet.
It is, but, and this is a big but, you can't just buy the shoes and call it a day. The sources were very clear that daily habits are just as important.
Absolutely. The shoe is a tool, but you're the operator. And the number one rule is never walk barefoot.
Never, not even in the house.
Not even from the bed to the bathroom. Especially if you have neuropathy. A dropped pin, a tiny shard of glass, a Lego. You can step on it, not feel it, and an infection can set in within hours.
Wow. Okay, that's a hard rule, but I understand the reasoning. And because of that, you have to replace feeling with seeing.
Yes, the daily inspection. Your eyes have to do the job your nerves can't. You have to physically look at the tops, sides, and bottoms of your feet every single day.
What if you can't reach?
Use a mirror on the floor. You're looking for anything, blisters, redness, cracks, anything your nerves aren't telling you about.
And nail care, too. The source was very specific.
Huge. Trim straight across, file the edges, don't dig into the corners. An ingrown toenail can be a surgical emergency for a PAD patient because it opens the door for bacteria.
So when do you call the doctor? What are the immediate red flags?
Sudden color changes. A toe turns white or blue. Any wound that isn't showing signs of healing after a day or two. And that claudication we mentioned, if the cramping pain when you walk is getting worse, it means the blockage is getting worse.
Okay. It's been a lot, but it's also incredibly empowering. I feel like we built a real management plan. Let's summarize this team approach.
I like that. It's a three-legged stool. First leg is your medical care, working with your doctor on blood pressure, cholesterol, the disease itself.
Leg 2 is you.
The daily checks. You acting as your own foot inspector. Never walking barefoot.
And the third leg is the gear.
The right footwear.
Okay.
Using the right tool for the job. You use APIS for severe swelling.
You use Propit to stay light and active.
Yeah.
You look at Anodyne or Orthofeet for seamless, hands-free designs. And Drew, if you need maximum stability.
And you don't forget what goes inside those heat-moldable inserts to offload the pressure. You put those three legs together, and you're not just comfortable. You are actively preserving your own independence.
It really changes how you see a pair of shoes. It's not fashion, it's a shield.
It is protective equipment, 100%.
So here's a final thought to take with you. We tend to think of our biology as something that happens inside of us, something we can't control. But what we've really learned today is that our external environment, even that tiny millimeter of space inside your shoe, can literally change your biological destiny.
That's a very powerful way to put it.
A wider toe box or a hands-free heel doesn't just feel better. It changes the physical forces acting on your body. So I'd ask you to just take a look at your shoes today. Really look at them. Are they helping your circulation or are they fighting it?
A very important question.
Thanks for diving deep with us. Stay curious and take care of those feet.
Take care.